Good morning, everyone. Welcome to our open house. Our first speaker is Tahlia Sage. My name is Elizabeth Papadopoulos. I'm the founding director of IHN, and it is my honor and joy to be here with you today. Tahlia Sage is a certified nutritional practitioner, a registered natural therapy practitioner, a herbalist, and also holds a Bachelor of Science degree in nutrition from the University of British Columbia. She has a strong scientific foundation in evidence-based nutrition. She is also a certified live and dry blood cell analyst and DNA analyst, which has furthered her ability to assess health concerns at a deeper level. Her expertise in holistic nutrition helps her bridge the natural and conventional approaches that she pursued in IHN study through the Diploma in Applied Holistic Nutrition and also a Diploma in Traditional Naturopathy at the Alternative Medicine College of Canada. Tahlia is trained as a herbalist from Wild Rose College, and she has also been in clinical practice for over 10 years. Tahlia teaches nutrition through the lifespan, symptomatology parts 1 and 2 through IHN, and also in our continuing education department, Tahlia teaches the advanced metabolic and endocrine transformation framework. And we are so excited to have Tahlia here today. Welcome, Tahlia.
Thank you so much for having me. Do I say the door prize now or after?
Yeah, you can absolutely.
So I can't see all of you guys. Nice to have you virtually to come on in this Saturday morning, Saturday afternoon, wherever you are. Welcome. Just so you know, I can't see you, but I'm excited to meet you. I have a door prize, which is when you submit for this prize, you get a functional analysis free one-on-one with me. That would be a no string attached discovery session, 30 minutes. I will provide a functional analysis for you, and if you bring any lab work for me, I will give you a functional analysis of your lab work. All right, so I look forward to meet one of you guys one-on-one. So today we're going to have a talk about natural conception after the age 30. You know, in IHN, I teach nutrition through the lifespan, and we're going to put a lot of health concerns with the lifespan perspective on it. So today, I'm not going to be able to talk about every aspect of fertility after 30, but I will introduce you an angle from the lifespan perspective. So thank you, Elizabeth. I can just skip over this section. You did such a great introduction for me. So yeah, basically my passion in my clinical practice is in endocrine and metabolic health. For those of you who may be new to this world, let me tell you a story about today's topic. So more and more in my practice, I have been meeting this type of client. This type of client, especially this one woman, I'm going to quote her. Her main concern really stuck with me. When you come into the first intake session with me, I often ask, what brought you here today? What is important to you? And for the last years, actually, it's been going on for years, I've seen women that have dedicated themselves their early 20s to build a career they love, they're passionate about. And now they're in their late 20s, early 30s, and they all of a sudden start to have this fear around getting pregnant. So this one client really stuck with me. And when I asked her what brought her here, she told me this one sentence that I have to put it on this slide. She told me, I'm afraid to go to the hospital to get pregnant. And it just like hits me. It's like, right. People used to get pregnant the natural way in the bedroom, but she has a fear of not being able to do it the natural way. And she's afraid because she has heard stories about the fertility challenges that's going on for her friends in her same age group. And what that fertility journey looks like for a lot of these women in their late 20s, early 30s looks like it unfolds like this because naturally getting pregnant in the bedroom is not possible. So this is the alternative medicated conception journey. So what it starts with, probably a bunch of tests, and then the IVF journey starts with a bunch of drugs. And then people don't know this, but you actually have to get a surgical procedure. It is actually, you will go under, actually. You'll go under, get the egg retrieved, freeze the sperm, freeze the eggs, and then you make the baby, instead of in the bedroom, you make the baby in the petri dish, in a test tube, like this. And then you get on a bunch of medications after you have the embryo implanted in you. You will get on a bunch of drugs because the body doesn't know it's pregnant yet. So one would have to get on a whole bunch of other drugs to help, a bunch of drugs that's most likely hormones, to tell the brain, hey, you're pregnant. And it will be in and out of hospitals. And that's what the allopathic medicated conception journey looks like. And this has become something that is a commonplace for not only just clients, but in my friend group as well. A lot of our discussion is surrounded by, it's like, I might have this fear, which is a lot of people never, if you are born, let's say, in a different generation, you probably don't know that people in this generation, even though you may be young and thinking about planning to have a pregnancy in the future, this might be something you worry about or is on top of mind. Even though you're not quite there yet, this is something that a lot of people are concerned about. And how has the world changed? Since the 1970s, the first time mom age, we call it in academia, we call it first time maternal age, has jumped by an entire decade. And that is very significant. That 10 years from a lifespan perspective changes a lot for both parents, for both first-time parents. And we're going to take a look at what that looks like and what that impact looks like. Globally, it's very, very surprising, especially in more developed countries. First-time maternal age can go up to as high as their people's mid-30s. And what comes with that is the fear that is presented by my client in the beginning. People, especially, I get lots of female clients, so my clients tell me, I'm really, really afraid to having to go to the hospital to get pregnant. And what does that mean? So in kind of like in the official terms, we call that assisted reproductive technology. It's called ART, or ART for short. So let's just see the scope of the problem we're facing globally. Again, even though if you're not planning to have a child right now, right this minute, or if you could be, on this path yourself, or you're just curious because you're passionate in helping others on their fertility journey, So this is kind of like a brief overview of the global fertility challenge that we're facing today. So in Canada, within this decade, let's just let this sink in for a second. Within this decade, the art industry, fertility services industry is projected to double. And this doubling of growth is within this decade. And something that's really, really shocking is compared to, that's stats from the States. So in Canada, we're quite similar in that way. Compared to early 2000s, that's like 2006-ish. You can think of yourself back in 2006, where you are in your life. So compared to 2006, the number of test tube babies, also known as IVF babies, have doubled in number. So the babies born that's using assisted reproductive technology has doubled in the States just within the last 30 years, or say 2 decades and a half, like 25 years-ish. And the global demand for assisted reproductive technology just like skyrockets. So what are the odds are if you're somebody looking to not get pregnant by the doctor, not having to go to the doctor to get pregnant? So your chances, according to the last human reproductive report, which is done every 5 years or so by the Oxford University, is a global assessment of fertility trends. And that trend looks like 1 in 6 couple, and that's global numbers, will be facing fertility challenges. And that's according to the last human reproductive report. And that is actually a little while ago. So it's like over 10 years ago. And this number, I don't know, could be worse. And let's take a look from both the male side and female, and then the male side of what exactly are the challenges that one would face from a lifespan perspective. And I want to put a disclaimer here that I want to end this presentation giving you a sense of optimism and hope. So if you looking at this number is really dire and is really dark and gloomy, especially the weather today is quite dark and gloomy as well, I want to let you know that this is not an inevitability. This is just average trends. And there's something you can do about it, especially if you are someone who is invested in taking care of your lifestyle, taking care of your nutrition, taking care of your mental, emotional well-being. This is not a reflection of your destiny. I want to let you know that there is definitely something you can do about it. So this is not your story. We're talking about averages, right? Averages from studies from the past, okay? This applies to the female. So as the female reproductive system ages, the natural rate of conception, so the chances for someone to naturally get pregnant with one natural period cycle goes down from about quarter. So actually, if you're in your early to mid-20s, your chance for a natural conception is about quarter, so 25%. And that sharply decreases to 15% per cycle in mid-30s. But again, I want to reassure you that is the average number. It's not your number, because there's a lot of things that you can do to improve this rate and improve your ovarian health and egg quality. Let's take a look at the male side of things. So shall we? So in the male side of things, this is according to the 2022 Human Reproductive Report. So Human Reproductive Update. You just if I could just draw your attention to the top left-hand corner here, this is kind of under the microscope, if you zoom in on one area of the microscope, the sperm density. And you can see that it has sharply decreased according to the data that's from the early 70s. In close to 2020, it has declined sharply by half. So on one hand, you have women who is more career orientated and they're delaying first time motherhood. And now you have on the men's side, you have a decrease, decreasing by half of fertility, the sperm density here. And looking at the hormone side, the testosterone side, according to this study by Journal of Clinical Endocrinology, that male bioavailable testosterone level has decreased by close to 40% in the early 2000s. So this data has a little bit of age to it. So in early 2000s, bioavailable testosterone has sharply decreased by about close to 40%, and the average testosterone level has decreased for about 30%. So not only we've got sperm concentration issue, we also have hormone issue. Now, at this point, I think there's a big question mark. Why is this happening? Well, now, in the IHN curriculum, you will learn about the endocrine disrupting chemicals that's in our environment and food system. And there's lots of other reasons to this as well. But what my focus on today is just one aspect of how, as a practitioner, as a future practitioner, how we can take a proactive approach to not get pregnant by the doctor. I want to invite you to picture this, okay? I want you to picture this plant here. I want you to picture this plant. What a plant needs to grow, to flourish. It needs care. It needs tender, loving care. It needs water. It needs sunshine. It needs good, nutrient-dense soil, right? So if you're missing these factors, this baby plant, or even like this, even a full-grown adult plant, if you're a gardener, if your plant is missing sunshine, water, nutrient-dense soil, it's going to wither away and is not going to flourish. And that plant is not going to do really well. So this is the concept I want to introduce to you in deficiency from a lifespan perspective. Indeficiency is a traditional Chinese medicine term. And what that describes, I think, is very, very fitting here in terms of reproductive fertility in people's 30s, 40s, and beyond. Indeficiency describes this type of pattern in people, which I think is quite common in the clients that I see. So indeficiency usually describes a type of people who's chronically overworked and overstressed. Indeficiency also describes, if you are in this category, if you chronically have some kind of background inflammation. And where that inflammation comes from can come from digestive issues, chronic gut issues, IBS, IBD, bloating. There's a lot of times there is a hidden background infection in the gut, right? Speaking of what the doctors see and what the holistic practitioner sees, a lot of these things are buried underneath the radar for conventional medicine, but you are going to learn the ways to detect some of those early signs and symptoms and be able to act on it proactively. If you have any kind of autoimmune condition, then you probably will have indeficiency, because that chronic autoimmunity is going to increase that inflammatory load for you, and that drains your ability to restore and nourish your body. Indeficiency also appears in people who have poor sleep, lack of recovery, and what that results in is libido and stamina decrease, and your poor ability to restore and repair your body and your cells. And that also includes your reproductive cells. So in a nutshell, what does that in means? In essence, it's basically that nourishment, that restorative ability, and that moistening and very restorative ability of your body. So when these things happen, when chronic stress, chronic inflammation happens, the body loses its ability to restore and recover. And what that leads to compounds with lifespan, compounds with years and decades, will be our body will try to go into self-preservation mode. So rather than giving you great fertility, it goes into self-preservation mode. And let's take a look at what are some of the symptoms. See if you can check some boxes if you have this indeficiency. And this definitely is a common trend that I've seen in my male clients, female clients, all over the place. If in your 30s, this is where some of that loss of restorative ability and optimal fertility starts. You can see if you experience some of these symptoms. You might be feeling fatigued, tired all the time, that you feel all the time, or you feel like you're just so used to not feeling your aching. Low libido, poor sleep quality. So that means the ability to fall asleep, the ability to stay asleep, because a lot of people would get up middle of the night and have trouble falling asleep. Indeficiency also have this feature, is kind of dry and hot. So if you have night sweats, I don't care how old you are. I've been having hot flashes and night sweats since I was 18 years old. So indeficiency is not age correlated, but I definitely see the older you are, the more extended you are, the more exerted you are without being able to recuperate, you become not being able to restore. So it's no matter how regimented your nighttime routine is, how regimented your sleep schedule is, you can't seem to recover. And then there is either people getting sick all the time or not get sick at all. Yes, if you have a lot of issues with indeficiency and your endocrine system, you may not be able to get sick, and get sick is once in a while, not too often. It's a very important thing for your immune system. You have digestive issues, not being able to digest your food, lack of appetite, constipation, diarrhea, and you feel like you have to just put a mask on. You feel like it's difficult. It's very, very difficult for you to just be yourself. You feel like you can't restore and catch a breath. You are putting on a mask when you go to work, and that may lead to you wanting to withdraw a little bit more. You want to do a little bit more introverting, social anxiety, all that kind of stuff. So let's break it down from a lifespan and endocrine perspective, what the indeficiency means. So it sounds like this energetic, restorative ability from the TCM perspective. But what I would like to introduce to you is the endocrine perspective. What the endocrine perspective is here is our reproductive abilities is tied in with the entire hypothalamus pituitary axis. Okay, so with this axis, what you see is there's our brain, right? And there's our thyroid, there's our pancreas, there's the adrenals, reproductive system. So that means overexertion. So in the brain, if you have overly stressed brain, overly activated stress signals in the brain, you're going to tax or overburden everything else on the system. So if one thing is kind of like if you have if you are imagine your workplace, if one person is slacking off, everybody else have to work harder to pick up the slack. But over time, people are going to get stressed, tired, resentful, and eventually that overexertion or trying to overcompensate is going to crash. So all of these parts in our endocrine system have that exact same feature. Is if one area gets overly taxed and overly burdened, all of the other areas have to somehow overcompensate and sacrifice some functionality to support your survival. And oftentimes, fertility is the first thing the body will sacrifice, because when your body is overextended and exerting itself, not being able to restore and recover, our body will naturally want to hold on to, to any kind of resources for itself rather than extending yourself even more to create another life. Let's take a brief overview of the interconnections and how these parts, how these endocrine organs impact on each other. And I'm going to briefly go into three areas that highlights some of the areas that I work on specifically with my clients clinically. So this is the endocrine tray. And I want to point out this one, okay? So let's take a look here. Our thyroid gland, it is kind of like this master gland in our endocrine system and metabolism. So our thyroid gland, a lot of people actually have hidden thyroid problems, speaking to like what's allopathic and what's functional. Actually, about 75%, according to this thyroid specialist who specialize in high subclinical thyroid disorders, that 70% of thyroid disorders are underdiagnosed or just not detected by conventional medicine. Thyroid has a direct impact on female ovulation, and also thyroid can be directly burdened by stress in other parts of the system. And you can imagine what a slow thyroid, probably know this already, what a slow thyroid looks like. Trouble with weight loss, trouble with energy, that kind of, in essence, is depleted type of situation. Thyroid can be a secondary outcome from other stressors in our endocrine system, but it can also directly impact ovulation. So you can form this vicious cycle of overly taxed thyroid impacting ovulation, fertility directly, and stress in every else part in the system burdening the thyroid. Now, with regards to our reproductive system, the reproductive hormones themselves, if they are not balanced, they can tax and overburden other parts of your endocrine system. Now, the next one is stress. When we have stress, our stress alarm, which locates right above your kidneys in your back, can shoot out these stress signals that tell your body to actually not have testosterone, not have estrogen, not have progesterone, because your body wants to take all of those hormones and direct them towards survival. So stress can steal your hormones, steal your reproductive hormone, and over time, that stress is going to really make the thyroid overwork and then getting resentful and starting the thyroid strike. And what ties in the middle is blood sugar. If you have a blood sugar, a lot of people, actually 40% of our Canadian population have something called insulin resistance. And if you are insulin resistant, basically all the hormone receptors on your cells are not going to be as sensitive. So if you're insulin resistant, you're also going to be resistant to all of your hormones, and insulin resistant raise overall background inflammation, exerting stress to all of your endocrine systems. So now I want to first talk to you about this stress, this like adrenal stress. Have you ever asked someone that's like in your life who's really, really stressed, or seem they have a lot going on, and you check in with them, a friend, you say, "How you been?" or "How are you doing?" They're like, "I'm fine, I'm doing great." And that describes a lot of clients. I want to invite you to draw your attention to this orange area, or is resistance, where your body has adapted to this escalated way of living. I call it, this is a very biologically expensive way of living. And what happens in this stage where a lot of people in our modern world is living in, especially people in their 20s. So that's the lifespan factor, where it compounds in your 20s and 30s because you can afford to burn the candle on both ends a little bit when you're younger, and you overstretch, overextend yourself. And now your body is in a very expensive, biologically expensive, elevated way of existing here. And you're so used to it and you're numb to it. When people ask you how you're doing, it's like, "I'm tired, but I'm fine. I'm fine. I'm a little bit tired, but I can get by with just more sugar, a little bit more sugar, more caffeine. Maybe I need to rely on that beer or wine a little bit too much, but I'm just doing fine." So when people stay in this stage for way too long, what happens is all of the endocrine system we talked about is going to get taxed. This is where people start to get belly fat. Might be okay everywhere else, but belly fat, you're starting to get more sore. Your sleep becomes less restorative, and your digestion may be showing you early warning signs. And this is to, like, if this compounds for another decade or more, and really depending on how your body is naturally wired and your natural predispositions, eventually the body is going to crash. So if you're in this phase for too long, right, your body is going to crash. And when you're stressed, your body is not thinking about reproducing. Okay, so this is where fertility challenges can happen, and this is where miscarriages can happen, because when the body is marinated in stress hormone, the body doesn't feel safe, and it have less of a chance to be able to hold on to a pregnancy. Over time, if you compound that, the timeline further into late 30s, 40, we're going to have decline, and this is where exhaustion can occur. This is where a lot of inflammatory, autoimmune things can start happening, where the body just kind of, hey, I'm going on strike because I've been overcompensating, overextending for so long. So it overworked to keep you at a level that's okay, but you're numb to this level, and then you'll crash. What I do for clients in my clinical practice is to support them using food, herbs, and supplements to kind of buffer this stressor in the system. So whereas you go really, really high, if you are chronically in this overstimulated, overextended kind of state, we'll work on your lifestyle, work on your nutrition. We'll also give you lots of good plants, herbs, to help you buffer that stress so you have a little bit more of a runway. And that plan will look like very, very different for everyone, because according to each of the stages, correspond to each of the adaptation stages that we saw. And oftentimes, if you're in the resistance stage, I will help to support you and uplift you. So that means if you're too tired and you have crashes, typically people with adrenal resistance will have some crashes. I will buffer your energy, give you a little bit of herbal support for uplift. And then if I notice from our labs and from your symptomology that you're a little bit too overextended, we're going to have to bring you down a little bit, calm you a bit more. And each of those stages will come with different personalized strategies. So there's something to do for everyone, and it's never too late. And this is more like a long-term investment. For myself, this is something, part of my self-care is to assess where my adrenal is and just give myself the patience because, my life is really fast-paced, and just being aware and recognize, hey, it's like I do want to work on my career, but I still want to support myself. So this is part of the strategy, that core foundation to preserve and protect your natural fertility. Now, moving on to the next one. When people are in that stress stage, something happens here. I want to give you a case example where I notice, when I work on blood sugar metabolism with clients, sometimes I have really great results. With some individuals, within 3 months, they can go from pre-diabetes to normal, like normal blood sugar levels. And that's quite impressive for some people. But for, I say about 40%, 40 to 50%, the other half of my clients, sometimes diet can actually not enough or not at all be enough for helping with that blood sugar level. And just to kind of bring us back to what we talked about, blood sugar, if you have insulin resistance and you have blood sugar imbalance, those means the same thing, insulin resistance and blood sugar imbalance, it raises the background inflammation. So it sends a stress signal to your reproductive system that things are more inflamed. So with that increased inflammation, it's going to damage the sperm cells. It's going to reduce the egg quality over time. So it's kind of like sizzling and searing your reproductive cells. That background inflammation is costly in a foundational level for your fertility. It not only raises that background inflammation, but also over time, it's going to interrupt your reproductive hormones, especially in the sense that people will notice when you have insulin resistance or blood sugar that's suboptimal, you are going to start making more fat. Okay. So usually the place you will see that is around the waistline. You may also start seeing the blood fat, blood lipid level, cholesterol, triglyceride start to increase, even like way before you start noticing your blood sugar level actually sending off stress signals. So with that increased fat percentage, these fats are actually, they act like hormones. When you have insulin resistant fat, these fat act like hormones that disrupt your natural rhythm. For both men and women, you're going to have a disrupted hormones and background inflammation from insulin resistance. And I want to just briefly touch on this different stages of insulin resistance, because I think some of you guys mentioned you're interested in be preventative, be proactive. So let me tell you something. One thing you will know is you're not going to see that from fasting blood sugar, the one that you either poke yourself first thing, or if you get it from Life Labs. There are other better data to look at. But let me show you this trend first, okay? Let me show you this trend, and let me know if you have any question in the Q&A section. It can take years, so that hidden insulin resistant problem, as you can see, can be lasting for years, where your early insulin resistance, you go for a long while with normal glycemic response. So you're not going to detect that from a regular blood test, or even like you check yourself. You're not going to detect that. But over time, when your body is under stress and you are having sugar, more refined carbs in the diet, the two compounds together, you're going to have insulin resistance. So just like your adrenal gland stress, you can be resistant, you can be in a long time insulin resistant stage and just not know it. And you will see slightly increased after meal sugar, but none of it would be detectable or recognized by allopathic standards. So a long time you will have what you might feel is kind of slumps after a meal. that kind of thing. And that can last for a very, very long time, years, sometimes over a decade, before people start showing the conventional medical signs of blood sugar problems. So that can be just kind of like brewing in the background for a very long time and costing your fertility and costing your reproductive health. The third area I want to point out is the thyroid factor. With the thyroid factor, a lot of people will start saying, hey, like, I don't have a thyroid problem. I went to Life Labs, the doctor is fine. I see my own report is not flagged. But actually, according to Dr. Brody, who's a thyroid specialist, that 70% of suboptimal functioning thyroid is not detected by conventional lab work. And that brings me to something I want to share with you, that your thyroid function is actually a secondary reflection of how your adrenals are doing and how good is your insulin sensitivity. So those two factors, at least for my clinical practice, have a direct impact on your thyroid function. As you can see, stress can make the thyroid overwork. And when something overworks, it will overwork and keep up for a certain amount of time, and then it crashes. Okay. So if your thyroid is sluggish, you feel tired, you are packing on weight, you're not imagining this. I just want to let people know, it's like you feel almost like this. It's like, what's going on with me? There's nothing wrong with you feeling like, hey, my thyroid is sluggish. I feel like I'm gaining weight easier. My cycle is not very regular. I feel tired, but my lab says it's fine. It could be that those two factors, what we talked about, are your adrenal health and your insulin sensitivity. You need a little bit more of a functional perspective on that and try to support your thyroid early before it actually become a full-blown thyroid disease. So here are, feel free to take a screenshot. I want to share my functional labs on thyroid with you. These are, so Life Labs will only look at this, and they only look at a really wide range of standard, but actually what signifies optimal thyroid function is a much more narrow range. And instead of just looking at this one pituitary hormone, functional lab will look at all of these to determine how well your thyroid is functioning. And just to tie it back to what we're talking about in terms of how thyroid impacts fertility. So thyroid directly impacts testosterone and estrogen progesterone in male and female. Thyroid is critical for sustaining pregnancy. Yeah, if you have hypothyroid, it's going to be less safe for the baby's intellectual development, brain development, and low thyroid is also tied with poor poor ability to sustain a pregnancy. So not only preconception, thyroid is important for regular ovulation, but to sustain a pregnancy, thyroid plays a huge role in that. So I want to say that it's very important, especially given that the indeficiency, endocrine stress compounds as we age, especially when I think about somebody who wants to delay pregnancy, wants to build a career first before they start a family. A lot of you guys are hard workers, right? Because you have a goal and you're working towards it. You're dedicated to it. You are invested in it. So a lot of times you are burning you're burning candles on both ends. So that will cost the entire endocrine system from an insulin resistant perspective, from adrenal perspective, and thyroid perspective. So I want to end, I think we're probably close to the end of our time together. I want to end on a note of optimism. And there's just so many stories I want to share, but I want to bring back to this one thing I want you to take away. AMH, or anti-Müllerian hormone, is a hormone that is produced by the developing follicles in the ovaries. It is one of the biomarkers I look at with my clients for assessing their fertility health. One thing I noticed, although conventional medicine does not recognize this, but with my support in my practice, when you start changing your diet lifestyle and truly understand where you are with your endocrine health and support your endocrine health at the core level and supporting that proactively, I've seen just within 6 to 8 months, I can see people's anti-Müllerian hormone level improving by 5 biological years. That's not recognized by conventional medicine. I don't know why, but I've seen that time and time again. When you decided to invest in helping your fertility, helping your endocrine system, your body appreciates that. So I want to end on this note. I want to thank you so much for your time. You can either, I'm sure Elizabeth will connect us to set up that functional lab analysis and functional health discovery. And yes, thank you so much for being here today.
So thank you so much for everyone attending Tahlia's talk today. If you have any questions, you can put them into the chat.
Yeah, I see we have a question here, Tahlia, from Caroline. Does birth control help with hypothyroidism? Yeah, that's the question.
I think I can see the question here as well.
Okay.
Caroline asks, does birth control help with hyper, not hypo? Hyper is like fast, right? As it was shown in the slide that it inhibits the thyroid. So first of all, with hyperthyroidism, there's different kinds of hyperthyroidism. The one kind I've seen, have quite a lot of experience with is called Graves' disease, which is a type of autoimmune hyperthyroid disorder. And there's in the pathology of Graves' disease, it's autoimmunity. So I'm just going to go with this example. In Graves' disease, what happens is the body start to produce the next slide. Can I share my screen?
Sure. Yeah, go for it.
So the next slide here, as you can see, that in the functional labs, we also look at the antibodies. So these are the antibodies that attacks the thyroid gland. In Graves' disease, it's like the body's immune system is start hitting and carving on the thyroid gland, and the thyroid goes fast, not because it works too well. It was actually screaming and shouting as it was getting killed by the body's immune system. So that fast-acting hyperthyroid in that case, it's not a good sign. So hyperthyroid doesn't mean you have like superb thyroid. It's actually your thyroid sending out stress signals. That's the process of that. So to bring it back to your question, the birth control pill, it actually add to the stress. So imagine the thyroid is getting like carved and stabbed by the body's own immune system. And now this victim that's getting stabbed and kicked, now you're putting bricks on it. So birth control pill is going to continue to burden this thyroid, whereas in the holistic perspective, we want to unburden the thyroid. Birth control is a burden on the thyroid for both hyper and hypo. So it's to reduce the overall inflammation and calm the immune system so that you actually preserve the thyroid tissue, if that answers your question.
Yeah, that's great. Thanks, Tahlia.
My pleasure. That was a great one.
The next question, what diet would you recommend for a woman with irregular period?
So if a woman comes to me for irregular period, what I would love to get to know is what type of irregular period that means. Is we can see sort of a spectrum, and depending on where that person is on that spectrum, I might ask for further data to confirm what kind of situation that individual is in. So for example, somebody can have something called like PCOS, that's called polycystic ovarian syndrome, which is characterized by skipped period. Actually, one of the hallmark criteria for PCOS is that they have less than 6 period in one calendar year. So that's one type of irregular period. And on the other side of the spectrum, we have people with fibroids inside of them, and the fibroids and is very hormone responsive, and every time they ovulate they will have period. So somebody who's having a period every 2 weeks, heavy bleeding, versus somebody who's having skip period, like no bleeding for months, right? So depending on where they are on that spectrum, I will gather more data and kind of understand what that irregularity means, especially if you're in my lifespan class. We're going to also put on our detective hat and say, okay, what kind of life stage is this person in, right? Is this person perimenopausal? Right? And then irregular period may be just natural, and we support that. But if somebody is trying to boost their fertility, they're in their late 20s, early 30s, and they have PCOS, they're not getting their period, we support that. We try to promote ovulation. So there's a diet for each of those situations.
Yeah, that's fantastic. Caroline says, well, thank you for the helpful explanation that you gave on the previous question.
I love it. It's like putting brakes on the thyroid. I love that. I'm gonna use it in the future. Thank you. That's a great question.
And last question, Talia, before we move on, from Marianne. Well, first she says, thank you so much for the presentation. And then her
Hey,
question,
Marianne. Hi. Hi to you.
do fibromyalgia, endometriosis, and PCOS also stem from inflammation? And also being a patient with hypothyroidism, are these two above,
Okay.
are these two above health issues quite common?
Okay. Let me do my best. Okay. There's many parts to this question. Let's do part one of this question. Is a fibromyalgia, endometriosis, PCOS, those are actually three separate questions. Okay. Fibromyalgia, endometriosis, PCOS, they all, what I can say is inflammation is part of the presentation or symptom presentation for all of those three diseases. Whereas when you're going to get into my SIMP1 and SIMP2, especially SIMP2, you're going to learn how to triage, and you're going to learn how to differentially assess your client, because I have not met two people with the same fibromyalgia, and I have not met two people with the same PCOS. Some of the principles and root causes are similar, but everyone is going to have their own, it's like your own passcode to your phone. That's the best way I can describe it.
Yeah.
It's like we've all got a phone, right? But the passcode is different.
Yeah.
Reach out to me if you want to talk about any of those diseases separately. I'm passionate about all of them. And then part two of that being, so with hypothyroid, so hypo is low and slow, are, yes, I definitely see concurring. So that means happening at the same time with, so actually one of the things to check functionally, I would push people to check, it's a full thyroid panel when they have fibromyalgia, because thyroid is like something that's governing your entire endocrine system, your metabolism, inflammation, and all that. So one of the things I would push for is a very properly done full thyroid panel for anyone who has a fibromyalgia diagnosis. Yeah, that's great. I hope that's helpful. I know
Yeah,
you're very passionate, Marianne.
that was great. Yeah, thank you so much, Talia.
My pleasure. That's a great question. I appreciate the mental exercise.
All right. Elizabeth, I think it's time for the giveaway, and then we have our
Yeah.
next
I
speaker.
have one more question here. Do we have time for that last question?
Yeah, just the very last quick one. Is it possible for some women naturally to have a longer cycle, like 35 to 40 days? Could that be just the norm?
Yes. So according to just the average, so the average is 28 days, right? That's the allopathic way of saying, hey, like this is the norm. But the norm for allopathic, you shouldn't use that for the individual. So how I usually say it is plus minus 7 days is within the normal range. So if say the allopathic is 28 days cycle, you plus that if somebody's cycle is on the longer end, so you plus 7 to that, 35-day is completely within the normal range. Okay, so that could be something that's normal to and healthy to a person. However, what I would say is a further follow-up with the question, is that normal or typical for this person experiencing the longer cycle? If the person has always been having 28-day cycle, but it's been pushed to 35 days, that might be an interesting point where we can expand on that further and investigate more.
Fantastic. Yeah, lots of great feedback, Tahlia. Your presentation was fantastic. Thank you today. It says for this insightful information. Also from Marianne, it makes so much sense now. Much appreciated. So thank you for that very informative and in-depth conversation, Tahlia. And the winner for Tahlia's incredible prize is Rekha, Rekha. Congratulations, Rekha. We put all the attendees in a spiral and it was a random selection. So do you want to just tell Rekha quickly, Tahlia, what your door prize was? I know you mentioned it at the beginning, and then we'll...
Yeah, definitely. So I'm offering a $100 value functional assessment for your health. So this is to kind of do like that functional differential assessment for you. When you provide me your lab work, whatever you've got, if you don't, that's okay. We're going to talk about the different areas for you and based on your main concern, primary goals, and I will provide a functional assessment, a differential assessment for you, and for you to consider on your health journey.
Thank you so much, Tahlia. And
Thank you, Tahlia.
Rekha, Tahlia will be in touch with you via email.
Thank you so much. I look
Thank you,
forward to working with
Tahlia.
you, Rika. And thank you for so many great questions that you have no idea that really energizes me. So thank you. I enjoy answering them.
That's great. Thank you, Tahlia.
Thank you for having me. I'm gonna go now.
Okay.
Bye, Tahlia.
Good luck to the open house. You guys have fun today.
Thank you so much.